Now, one of the perks of having friends living across the globe is that you have a lot to share, you have a lot to listen to, and this has given you a way to look at things from a whole new perspective. Now, speaking of share, we will be listening to them as they tell us about their experiences on COVID 19.
I actually spoke with one of a friend of mine. She works in ICU in New York, and it's just very horrible and really gut wrenching hearing the stories of people dying by themselves.
Except for us who are teaching because schools were shut down as well as the private academies.
Unlike, we're not allowed to get out in our car without checking body temperature, so someone has to come to your car to check your body temp.
Red zone being the deadliest one are the one in which the strictly rules are followed and people are not allowed to move.
Pero dito po, no work, no pay. You have to work talaga. Wala po ditong support, especially for the foreigners.
To respect the rules and regulations that they gave us, dili ta mo labag ana.
Protocols, guidelines, state policies has been changing dramatically each day.
I will use the word devastated or devastating, especially in the lives of our kababayan. Yun nga, kasi nga na-force leave sila.
Most of the schools, theme parks, tourist spots are closed. Events are cancelled. There's also a travel ban imposed.
But the start is like really stressful, and I think that's how it is. Like, we Filipinos chose to survive the situation. I chose to survive the situation.
What's up, guys? It's Megan Karaoke and TGIM. Thank God it's Monday. We're actually having a skeleton work first, so I'm assigned for Mondays and Tuesdays. I'm on my way home and I'm excited to listen to my friends from different parts of the world.
So I am no expert with this topic, but I just want to say my piece about it. I used to be a registered nurse working in ICU, but now I transitioned myself to become a full-time entrepreneur, working from home. So I actually been shelter in place here in California for more than a month already, and we have an extension till like May 30. So that means only essential things that I should be doing, meaning I can only go out when I go groceries and do some essential things, which is very, very important in times of this crisis. And you know, I see a lot of people also complaining like they can't go out, they're bored, everything should be open and stuff like that. For me, I always believe that we just have to come from a different perspective. Actually, during the COVID crisis, I haven't been really out. And, you know, when your life is always on the go, sometimes you neglect and forget things, and you tend to be ungrateful instead of being grateful for what you have. What I mean about that is, like, instead of you saying, like, you get bored staying home, why don't you put yourself in a shoe of those frontliners, people that has to go to work and can't stay home with their family because they have to work and they have to serve people. Your dilemma is just getting bored staying home, but those people wants to stay home but they can't stay home, and they're putting their lives at risk because they have to serve the needy people or the dying patient. I actually spoke with one of a friend of mine. She works in ICU in New York, and it's just very horrible and really gut-wrenching hearing the stories of people dying by themselves.
Hello everyone, I'm Manon Kim and I'm living here in South Korea. I've been here for almost 8 years already. Talking about this coronavirus, this pandemic outbreak started in late February and it was very difficult for the country at that time. Imagine Korea was listed as second to China. That time, every day there were around 1,000 people infected. Although there was no total lockdown, people were advised to wash our hands, use hand sanitizer, wear our mask, social distancing and avoid going to public places. Of course, people were still working every day, except for us who are teaching, because schools were shut down as well as the private academies. But then, after a few weeks of fighting this pandemic, the government was able to slowly flatten the curve.
Experience here in USA about coronavirus. It's in state policy that we are not allowed to go to grocery store or anywhere without wearing mask. So last time I went to like Costco and I saw this police officer like standing next to the door in Costco and checking each people if they wear mask or not. And you're not allowed to enter in like grocery store or anywhere without wearing mask. They're so strict about it. Then about work too, oh my god, we have to be there early in the morning, and like we're not allowed to get out in our car without checking body temperature, so someone has to come to your car to check your body temp, and if you don't have a fever, so you're allowed to go. If there is, then they send you back home.
This is Tushar from India, and the COVID-19 cases in India are around about 40,000, out of which only 10,000 are recovered. In India, there are 3 zones in which the entire country is divided into, that is the green zone, orange zone and the red zone. The red zone being the deadliest one are the one in which the strictly rules are followed and people are not allowed to move, whereas the orange zone are the moderate ones and the green zone is the safest where there are no corona cases at present. Further, I am very glad that the people and government are very supportive and they are working continuously to isolate this deadly virus from the country. We, India, also support the people from entire world to eliminate this virus, and we are working together as a team so that we could all save us from this deadly virus.
Hi guys! Ito po pala si Cherry Ann Byron at nakatira po ako dito sa Sweden, sa Europa po. At ngayon po ay pag-uusapan po natin kung paano hinahandle ng government namin dito si coronavirus at ang pandemic. So yeah guys, first of all po, ang Sweden ay walang lockdown po. Lahat po ng Europe is having a lockdown po. Denmark, neighborhood lang sila eh. Yung Denmark, lockdown na sila eh. Wala pang 500 positive. 500% positive. Wala pa silang 500. Wala pa nga sigurong 200. Nagla-lockdown na sila. Pero dito po, wala po kaming lockdown. At tsaka wala po kaming quarantine. Ano lang, wash your hands. So parang pag narinig mo, ano ba yan, wash your hands lang? Yes po, totoo po. Wash your hands lang po talaga kami dito. Grabe, ang napakaganda naman dyan sa Pinas. May relief goods, may mga pera na i-distribute. Pero dito po, no work, no pay. You have to work talaga. Wala po ditong support, especially for the foreigners. Pero, yung mga Swedish citizen po dito, meron po silang makukuha. Schools are open here. The high schools, elementaries, and kindergartens sa mga bata. Yung mga bata dito, 1-year-old pa lang, or 6 months nasa school na sila eh. Kasi nga, dito, yung mga parents is nag-work talaga. Both parents are working.
According to my mom, the only way we can protect others is to take care of ourselves, because we cannot protect others if we do not take care of ourselves, you guys.
Friends, this is Keith, and I hope you are all staying at your home right now. Protocols, guidelines, state policies has been changing dramatically each day, but it all boils down to one, and that is to protect us all from harm or getting infected by this virus. I've experienced wherein I was able to assist and observed the collection process for a specimen to be tested for COVID-19. So from the collection, shipping and handling up to the reporting of the results, we follow or strictly follow the rules and the guidelines set by CDC, or the Centers for Disease Control and Prevention, and the World Health Organization.
Hi guys, this is Christian Reyes Laksamana. I live here in Abu Dhabi in United Arab Emirates. I've been here for a year now, and I work as a subject teacher in one of the Philippine schools here in Abu Dhabi. So basically, our lives here, we Filipinos, we are really protected by the government in terms of precautionaries in line with the COVID-19. You know, we have basically curfew, and the government also required some establishments to limit their people, their staff. The total impact of the COVID-19 situation here in United Arab Emirates have been, you know, I will use the word devastated or devastating, especially in the lives of our kababayan. Yun nga, kasi nga na-force leave sila. Pero it's all about how we discipline ourselves. Let's cheer up. I know Filipinos and kababayans are known for being resilient. So no matter what happens, that keeps our faith high. Always believe in God, no matter what happens.
My name is Yona and I'm living here in Japan. As of May 4, 10 a.m., there's been 15,791 cases of COVID-19. Unfortunately, 549 people died. And as of May 1, there's 4,632 people that recovered. And just recently, the Prime Minister has extended the state of emergency here to May 31. However, when we say state of emergency, it does not immediately equate to a total lockdown. This means that we can still go out whenever we want, for whatever reasons. But the government is strongly requesting the people here to stay at home and only go out whenever needed. The malls, most of the schools, theme parks, tourist spots are closed. Events are cancelled. There's also a travel ban imposed. However, our trains still operate normally. And for how we live currently, well, for me at least, I've been working from home for almost 2 months, give or take. Now, for our groceries, unlike some countries, they'd have to wait for a number of time to get in, or in some cases, there'd be shelves that are empty. That's not the case here. The food supply, we have enough food supply. And as of now, the Japanese government hasn't found any vaccine for this virus yet. The clinical test for a vegan is still ongoing. As I've mentioned before, I've been working from home and I'm very lucky to have this type of opportunity. And a lot of people are losing their jobs. So the government is providing 100,000 yen to the head of every household, every registered household here in Japan. So that's really a big help.
I'm Christian Kiftan. I live here in Edmonton, Alberta, Canada. The effects of COVID-19 is really stressful and challenging. Luckily, the government here is supporting the ones who are really affected with the situation, where their workplace has been closed or they voluntarily stay at home because of they don't want to get the virus. The government is actually supporting everyone with $2,000 a month, depending on the stipulated qualifications of the certain support. It's basically an emergency fund that you get from the government. As per my situation, I chose not to get laid off or to stay at home because of the situation. I chose to work. I chose to fight the situation. Even though we're not getting much hours, like in my situation, I work in McDonald's Canada, and we're getting less hours, but I think it's okay. We can still survive the situation. We just had to make ourselves prevent the spread of virus what happened here is like they only implement social distancing, no lockdown, no quarantine. It's because the government of Canada is really on point of implementing rules and regulations on how to prevent the spread of coronavirus. That's why, as you can see, Canada doesn't have high cases of the COVID-19.
I mean, for me, the best way really to prevent this is really to avoid it. How do you avoid it? By, following the guidelines of the CDC, or like the Central Disease Center, which is like you wash your hands continuously or often. Make sure you wash your hands like 15 seconds the least. At the same time, wear some protective gears when you go out. May that be like mask, covering your face with some cloth, and stay away from crowded places. Maintain the 6 feet distance. It is very, very important. Prevention is always better than cure. So if that's the case, for us to prevent from getting infected, may it be and just follow it, right?
So if we arrive at home, before entering your room, before touching anything inside the kitchen, always wash your hands first. Disinfect and sanitize everything. So after washing your hands, sanitize everything that we touch every day. Like for example, doorknobs, handles, everything that we touch every day. So we all know that. The clothes that we wear out, always strip off when you enter the house. Strip off immediately and put it immediately in the washing machine and wash it. So that's it. Always watch the news and be always updated on what is going on in our world right now.
3 T's. The first one is trust. There was a lot of trust on how the government was responding to this pandemic. Second is testing. There are lots of testing centers here in South Korea. The third one is tracing. Tracking each individual and inform all the people so that they can be prepared and get tested. They communicated transparently with plain, factual, and straightforward information.
I request all of you to stay at home and support the doctors and the workers who are desperately working to save our lives.
Right now, everyone, I think it's getting better, but the start is like really stressful. And I think that's how it is. Like, we Filipinos chose to survive the situation. I chose to survive the situation. And I think that's how it is.
Always believe in God, no matter what happened. Ang dami ko no matter what happened. Ayun, so God bless everyone. And please, segue ko lang, do not forget to subscribe to my YouTube channel. It's DONLOPEZ, and that's Don Lopez. Thank you guys. God bless you all.